The Dr. Payne Show is a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Talk Radio AM 640. If you'd like to know more about what you hear on today's show, please visit paincarecanada.com or call me directly at 1-855-55-DR-LOU. That's DRLOU.
The pipes on that guy. 12:03, Dr. Payne Show back here on your Saturday afternoon, 12:04, pardon me. 416-870-6400, star 640 on cell. We have a ton of stuff to get through the show today. We'll have a guest on in just a few minutes here, but want to talk about this before we get into it, and that is we're talking about consultations. I know you and Anthony were talking about this just before the show. So give me some details on that and stuff people don't maybe realize about the consultation.
Yeah, I think since we've started the show back in early September, we've had a ton of people that we've been able to help that have come to see me or someone part of my team. Mm-hmm. The biggest thing that we have found is that there's always some type of a stigma around, is there payment required to see me? And what I want to let the listeners know is that my consultations are free. They're free paying consultations. We can do this over the phone. We can do it in person, whatever suits the person best. And in that short 10 to 15 minutes, I'll be able to quickly identify, is this a problem that is something that I can help with or that my team can help with? And if not, I'll also be able to identify, if it's not me or my team that can help with it, how do I get that person somewhere where they can find the right help for what's going on with them?
Mm-hmm. Now, you said you have a team, but people will, I mean, I guess it's, you'll go as far as you can to find good help. And that is, people will drive down from Barrie or wherever just to see you for that consultation, yeah?
Yeah, one of the things we have a network of providers, like I've mentioned, across southern Ontario, all the way up in Barrie and all the way out as far as Oshawa and out as far as the Hamilton area. And one of the biggest things is that we found is most people want to come see me for that initial point of contact, and people are not opposed to that, and people are driving to see me, and then I'm able to, maybe if they need more consistent care, and if they're coming from Barrie, we're not going to have them drive an hour 2 times a week just for care. We have a provider up there. But I think most people listening to the show want to get my personal opinion. And again, that's something that we can quickly do. They can call us at the 1-855-55-DR-LOU number. Quick consultations. We can do it over the phone. We can set up a time, 10 to 15 minutes, like I said. Or also they can come in and book an appointment at the clinic where they have that free consultation.
Let's get into our discussion as we do each week on pain and some of the things surrounding that. Now, it's absolutely gorgeous out there today, and this next week looks pretty good. But Wednesday was already a little hint of what's to come, and there was some snow in Ottawa on the outskirts of the GTA. So pretty soon, people are going to be pretty lax getting snow tires. There's going to be accidents. There's going to be people getting whacked up in cars, injuries, and all that stuff's going to start coming through your office, right?
Yeah, this is definitely a busy time for us, especially when you look at motor vehicle accidents as the weather starts to get worse in the fall and into the winter. People are hurt in their cars, and they end up coming to our offices. Some of the most common injuries that we'll see from car accidents are things like low back pain, neck pain. Shoulder injuries are very common as well. It really does depend on the mechanism of the impact of the car accident, more often than not. And we have Sivan here today who can probably comment because he sees a lot of this stuff. But I know with what we see, the majority seem to be rear end or head on collisions. Mm-hmm. And in those instances, that's when you're dealing with the whiplash in the neck, low back pain. The jarring effect throughout the spine really causes problems. And oftentimes it's minimized in the beginning, the impact of the injury. A lot of times the pain that is actually that's going to set in doesn't set in for a few days. So people will go through a car accident, think, you know what, I'm fine, nothing's wrong here, and then they'll just dismiss everything. They're talking to their insurance company. No, I'm fine. I don't need any treatment. I feel okay. And then days, weeks, even sometimes months later, the impact of that trauma starts to set in. And this is where these people now need the help. And that's why we have Sivan here today to also comment on the legal rights that people have when you're involved in something like a car accident. Who pays for what, etc.
416-870-6400, star 640 on cell. Yeah, Sivan Tumarkin, the Insurance and Injury Law Show here on Talk Radio AM 640. Brada, you've been doing this for a while. The show and, of course, your business. So what's your opinion on that? What Dr. Lou's saying?
Well, John and Dr. Lou, thank you for having me here. Dr. Lou is completely right. This is something we're going to be seeing more and more as the winter comes, as we have bad weather. And it is absolutely imperative when somebody is injured in a car accident to get the right treatment, to get the right diagnosis, and to make sure that they continue going for that treatment. I can tell you that from a legal standpoint, especially if you're involved in a car accident, your own insurance company is going to cover that. It's called no-fault benefits. You are entitled to get those treatments paid for. So there are recourses for that. It's not out of pocket. And you may, of course, have collateral health benefits. You may have health benefits through work. You may have that through a spouse. Again, you can access those benefits. Those benefits are there for you to utilize them. And if you don't take that initiative, and if you don't get the proper diagnosis, you don't get the proper treatments, that is going to impact your case, especially if you are making a claim for pain and suffering, if you're making a claim for other types of expenses that we often talk about on our show, John. So very, very important to make sure that you get the proper treatment and that you continue getting the treatment over the long run to make sure that you heal.
How often do you hear, and I guess, Dr. Lou, you'd answer this as well, or people call your firm, Savannah, they say, you know what, it was 3 days ago, got a little bit of neck pain, but I don't think it's going to get any worse than this. And I think a lot of that is the adrenaline of the first impact of the accident comes into play. And like I said, they don't feel it, right? So you guys must give them some warnings that just, relax there, Sparky. Give it a few days, it might get a lot worse, right?
Yeah, one of the things that I really try to advocate for in that regard is, and we have a lot of existing patients who are patients that are seeing us at the clinic anyways, and then are involved in a car accident. And they try to minimize, it wasn't that bad. It was just a little fender bender. We're going to leave it, no claim. And again, they're not realizing the impact that this could have going forward, because the reality about trauma is, and it really depends if the person's young, if they're overall healthy. What happens when they're not young anymore and they're not as healthy as they used to be? The trauma that your body takes stays with you forever, and it may have long-lasting effects later on. And so I'm always a big advocate to say, well, listen, there's a reason why you're paying for insurance and why that insurance gives you benefits in order to get the care that you need when you sustain these types of injuries. And then the other conversation that I always have, and it's a kind of a saying that I've always said, is that a personal injury lawyer becomes part of your healthcare team when you're involved in something like this, whether it's a car accident or a slip and fall, because the reality is, in my clinic, our job is to provide the care that the person needs in order to get better. Right. The other reality is that we don't know everything on how people heal at any given time. We take what is the best educated guess that we have based on the prognosis. But the reality is there's a lot of factors that play into people's healing. And sometimes if you don't heal within what the insurance company determines to be the allotted time that you would likely take to heal from this, then you're stuck at a point where you don't have any more benefits, but you still need more care. And unfortunately, that's not something that I'm going to deal with. That's not my role. That's where someone like Savannah and his team come into play. That's their job.
We'll get to that conversation after a short break. Your phone calls, as always, lines are wide open, 416-870-6400, star 640 on cell. Dr. Payne Show continues. Talk Radio, AM 640. 1214, got open lines here. You want to give us a call? We'd love to hear from you. Savannah's here for the hour as well from the Insurance and Injury Law Show. And, of course, Dr. Lou here is answering all your questions as it pertains to rehab and using stuff and using his clinic. Anyway, Omar in Milton. Good afternoon, Omar.
Hey, thanks for taking my call.
What's your question, pal?
So my wife got diagnosed with IIH last year, and I'm just wondering if Dr. Lou can do something about it. Like, she's seeing a couple of neurologists, but it's not helping out that great. And I was researching in New Zealand and Australia, they have acupuncturists, that can help you. Mm-hmm. But I didn't see anything, in North America or some stuff like that.
Yeah, so for our listeners who don't know what IIH is, it's idiopathic intracranial hypertension, which when we break that down, idiopathic, I actually remember one of my first teachers when I was in school when they were teaching us the term idiopathic. Basically, that means that we don't know where this starts from. That's what the term idiopathic means. And the way I've always remembered it is he used to say the doctor's an idiot and the patient's pathetic. So idiopathic and intracranial hypertension. So yeah, I always talk about this, Omar, when someone is exhausted, the more traditional Western approach to their therapy and things are not getting better, we still have other alternative types of treatments that we use in a complementary and integrative manner that may still be available, such as you alluded to, acupuncture. And when you're looking at something like this, the intracranial hypertension, and it's not, and a neurologist has probably provided some medication, maybe it's not helping based on what I'm gathering from you, something like acupuncture, maybe chiropractic care, maybe massage therapy, there's a way to affect the musculoskeletal system, which may have a benefit on affecting the blood flow, which would therefore affect the hypertension that's being created intracranially. But again, with this type of thing with IIH, we don't really know what causes it. And, I'm not suggesting that we'll be able to cure it, but definitely it may be something that we can help your wife with her symptoms. And we do also offer those more integrative and complementary types of therapies, such as acupuncture, chiropractic, and other things like massage therapy. When we're dealing with these people, we try to look at everyone in a very holistic manner where we treat them with all our available resources, whether that's going to include medication, referral to someone like a neurologist, but also taking into consideration the importance of other types of modalities and interventions, such as acupuncture.
That makes sense, Omar?
Yeah.
Okay. Write down this number, 1-855-55 Lou. That's the number you want to write down and call when the show is over. So let's get into this conversation. We were talking about this a little bit off air before we went in. That's the whole thing with insurance companies and clinics and certain clinics and people being referred to certain clinics. One of you guys can go first. Who's it going to be, Savannah, or could it be you, Dr.
Yeah,
Lou?
I'll allude to it. One of the things that we often see, and definitely Savannah can touch on this a lot more, is that when you're hurt in a car accident, you're going to obviously call your insurance company and you're going to be speaking to an adjuster. Yeah. That adjuster is going to give you what they call their preferred provider list of clinics to go to. And I'll so that it's not biased, I'll let Savannah speak to that this may actually be something that hurts that person's claim, because now they're going somewhere where the insurance company and that provider have some type of mutual understanding and relationship that may not necessarily benefit the patient. Savannah, do you want to comment on that?
Absolutely. There's nothing that makes me more angry than insurance companies not only not helping the individual that they're tasked with helping, but sending them to a clinic where that clinic essentially is connected to the insurance company. That's not to say that the insurance company owns the clinic, but think about it this way. Insurance company tells you, John, you're injured, go to clinic X. In 6 months from now, the insurance company is going to communicate with your treatment providers and ask them, do you think that John has had sufficient therapy? And of course, what are you going to say? Or not you, but what are your treatment providers going to say? Are they going to say the truth, or are they going to give the insurance company the answer that the insurance company is looking for? Exactly, because the insurance company is being fed. Sorry, the clinic is being fed by the insurance company.
Wow. Okay.
So there is a conflict. And even if there isn't a conflict, in my view, there is an appearance of conflict. Yeah. So do not go to clinics that the insurance company is telling you to go to, because from a legal standpoint, that could contaminate your legal case. Not to mention the fact that some of these clinics, and I can tell you from personal experience, are not good. It's just that simple. They're not good. Their rates are extremely low. Their practitioners sometimes don't even know what they're doing. Don't do it. And I've spoken to Dr. Lou at length. I'm very comfortable with how he runs the clinics, about the various practitioners that he has. But just generally speaking, as a general rule, if the insurance company tells you go to this clinic, that's your signal that you do not go to that clinic.
So how does one pick a clinic? I mean, obviously come see you, obviously.
And one of the things, adding to what Savannah is mentioning with these types of clinics, what you have to look at is the majority of their income is through that relationship with that insurance company. So of course they're going to be biased towards the benefit of the insurance company, because the majority of their patient base, and I've seen a lot of these clinics and I know a lot of people that own these clinics, Savannah's absolutely right. They're not always the best clinic. Am I going to say all of them are horrible? No, but a lot of them are just one-man shows, one woman show, one person the same person who's treating you is the same person who's billing things for you, is the same person who's answering the phone. That's not run properly. What I think is important to look at when you look at a clinic is how diversified the patient base is, because that will give you a sense of, is there any one type of only one thing contributing to the patient base in this clinic. And when you look at my clinics, yes, we deal with car accidents, but that's just one component. We're also dealing with OHIP patients. We're also dealing with extended healthcare patients. We're dealing with WSIB patients. What we're dealing with is with the individual that needs help. That's our primary objective. We don't work for insurance companies. We work for people who want to get better. And I think that's an important thing for people to realize is when you are looking for a clinic, look at where are they getting the majority of their patient base from. And again, if you maybe were referred from an insurance company, maybe a lot of that patient base is just from the insurance. And as Savannah alluded to, this may affect your claim going forward.
You got a question, comment, something, a pain concern as well? Of course, that's why the show is here. 416-870-6400 star 640 on sale. Lots more of the Dr. Payne Show. After a short break, can Talk Radio, AM 640.
The Dr. Payne Show is a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Talk Radio AM 640. If you'd like to know more about what you hear on today's show, please visit paincarecanada.com or call me directly at 1-855-55-DR-LOU. That's DRLOU.
1224, Dr. Payne Show here till 1 o'clock, 416-870-6400 star 640 on cell. Savannah is here from the Insurance and Injury Law Show for this hour as well, answering some questions and some of the crossover you guys do each and every day of every week, I guess, when dealing with patients at the clinic and at the law firm as well. We should mention as well, we're not just focusing, just because the time of year we kind of mentioned car accidents off the top, but this has to do with slip and falls and disabilities as well. So talk about some of those injuries that come through your clinic.
Yeah, and again, this is all relative, I guess, to the time of the year. Also, with the bad weather, not only could you get hurt in a car, but you may get hurt just walking on the sidewalk or walking in a strip plaza. There might be ice, slips and falls. Any type of long-term, short-term disability claim, car accident. These are all things where there's a third-party payer involved who's going to pay for your health care benefits that you're going to require. And those are the types of things that we're dealing with here. And I know Savannah and his team, they're dealing with all things related to personal injury and not just motor vehicle or car accidents.
Let's talk about whiplash. You mentioned off the top.
Yeah, whiplash, again, very common. It's an injury to the neck. What happens in a lot of accidents is your head, as the name suggests, will whip back and forth. And in doing so, there's trauma created to the joints in the neck. And when you look at, there's been a lot of research and a lot of forums done around whiplash, and there's different degrees of whiplash that can occur. And it's graded from grade 1 to grade 4. The most common falling within the grade 1, grade 2, which you're talking about soreness, a little bit of radicular features being that, meaning referral pain into the upper limb, those types of things. And then you can get into the more serious of 3 and 4, where you're dealing with true neurological deficit and or fractures. And these are the cases especially, and I'm sure Savannah would agree, where you need to have a good personal injury lawyer on your side when there's a very, very serious injury. And I'm not minimizing when it's a more, one of the discrepancies that exists in the system that we're in when we talk about car accidents is they've gone into something called the minor injury system.
MIG, yeah.
Yeah, the MIG. And in doing so, what they've basically said is if it's not something like a fracture, a broken bone, something very serious, you're classified as a minor injury. It's just soft tissue. It should heal within 12 weeks. You have X amount of dollars, and that's all you're going to get. And the thing that's not realized by the insurance company and what people need to realize is there's a lot of factors that affect the way someone heals. So yes, do a lot of soft tissue injuries heal within 12 weeks? Absolutely. But what happens when you're looking at a young, healthy athlete who suffered that injury versus an old grandmother who suffered that and maybe has diabetes? Is it fair to say that healing time, that prognosis is going to be the same? Absolutely not. And that's, again, where you need someone like Savannah and his team on your side in order to make sure that your claim is not being minimized as just a minor injury, just the soft tissue, because that may very well affect a lot of your life. And also another thing, and maybe Savannah, you can touch on this, is when people suffer these types of injuries, the pain and suffering component is very big. And also, if there's a civil wrong done in this, if you're rear-ended, you're at a stoplight, you're minding your own business, and someone who doesn't know how to drive rear-ends you, there's a tort side to that.
That's right, absolutely. There's a tort side. When what's a tort side? It means that you have a claim against whoever was at fault here. Mm-hmm. And whoever was at fault, who rear-ended you or went through a red light, they're going to have insurance, and their insurance is going to respond to the claim. And you're completely right. We're not just talking about medical and rehabilitation expenses. You may be out of pocket for certain things, medications, etc. Maybe you can't go back to work. Maybe you've now suffered an injury that's going to be with you for the rest of your life, a chronic pain type of an injury. And, when you spoke about the MIG, the minor injury, we're talking about things like shoulder tears, for example. Mm-hmm. A partial tear apparently is a minor injury. Yeah. It's ridiculous.
It's
right?
laughable.
But
yeah.
It's absolutely laughable. And, I just, there's a few cases that come to mind that I had resolved fairly well in the past few months, these are cases where you had fairly minor collisions. But because of the precarious and the vulnerable state that the person was in, right, you can have somebody, for example, who had a bad back. And so that person will get impacted a lot more than someone who is completely healthy. And that person's pain through the months and through the years became so chronic that he wasn't able to go back to work. And then there is a psychological component, an overlay. So it's extremely important to get the right treatments at the beginning, but also go to the right lawyer at the beginning to make sure that they work in tandem to maximize not only the treatments so that you can get better, obviously, as well as whatever benefits and whatever compensation you're entitled to. And in many of these cases, even though they may seem small, incidentally, they may snowball into just absolutely catastrophic type of effects on an individual.
I'll ask both you guys, I guess individually or together, maybe it's the same. This whole thing with the MIG, how big of a thorn in your side is it as far as the limitation of it?
Yeah, I think you have to look at why it was implemented. There were a lot of bad things going on, I believe, in terms of people maybe, and I'm sure Sivan knows about people staging accidents because of how much accidents were worth. So does the system need policing? Absolutely. Is it fair to say that everybody is a minor injury if it's not a broken bone? Like Sivan said, you have a partial tear of your shoulder and that's classified as a minor injury. That's the same as just a small contusion? No, absolutely not. I think that's wrong that the insurance companies are classifying this as almost an all or none. I think there's a big gray area, and I think we need to look at and do better research on understanding that gray area, how different people are affected by different accidents. And one of the things that Sivan said that I thought was very interesting, we have a lot of patients who do have already existing low back pain. They're involved in a car accident, and a lot of times they come out and all that's really hurting is their low back. And they think, well, I already have a
It was
back.
already there.
It's already there. So this isn't anything that I have to worry about. No. That's absolutely wrong. You have to probably worry about it even more because there's an existing condition which is likely to become exacerbated and potentially become worse over your lifetime because you already had something there. And now because of something that happened, it's going to compound. There's a compounding effect here.
416-870-6400 *640 on cell. Would love your calls and opinions on all this. If you've been through this, been through the ringer, so to speak, give us a call and give us your opinion. Any questions, the guys are here to answer that for the remainder of the hour of the Dr. Payne Show on Talk Radio, AM 640.
The Dr. Payne Show is a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Talk Radio AM 640. If you'd like to know more about what you hear on today's show, please visit paincarecanada.com or call me directly at 1-855-55-DR-LOU. That's DRLOU.
12:33:34 here on the Dr. Payne Show. Your phone calls, you got concerns, you've been through this. We're talking about insurance companies, been through the physio clinic. You got some opinions, some pointers, some questions, plain and simple. Lay them on us until 1 o'clock this afternoon. So my notes here as I read them for Sivan and you here, Dr. Lou. The legal process involving MVAs and slip and falls. I know what a slip and fall is. I don't know what an MVA is.
Yeah, in terms of the legal process, we have Sivan here. He's probably I know my stuff around it, but clearly not as much as Sivan. So I'll let him talk about the legal process surrounding those types of injuries.
That's right. So for the for people out there who haven't been in a car accident, congratulations. Okay.
Right.
Unfortunately, the majority of people at some point in their lives are in a car accident, and many of them get injured. And so, what happens when you are injured in a car accident? MVA means motor vehicle accident. So, first of all of us have to carry automobile insurance. Okay, it's mandated by law. And so you're paying for those benefits. And what are those benefits? It's a safety net. It's a safety net in the event that you are injured, in the event that you can't work, in the event that you can't do things around the house. And so if you are injured, your insurance company, of course, has to be notified immediately, not just for the property damage, right? If your car is written off, but if you're injured, somebody's going to have to pay for the treatments. Your insurance company pays for those treatments, and that happens whether or not you're at fault or not. That's why they're called no-fault benefits. as well as accident
sense.
benefits. Exactly. And in terms of the amounts, well, that varies. It depends on whether or not you're classified as within the minor injury guidelines or if you're above that. If you're above that, then for medical rehabilitation benefits and attendant care benefits, so things, if you need help around the home and if you need certain treatments, the type of treatments that Dr. Lu's clinics provide, you have up to $65,000 for those. If you're within the minor injury guidelines, $3,500. Again, keep in mind, if you are injured, you should get those treatments. I mean, it's a no-brainer. And some people feel as though they are scamming, quote unquote, the system. You're not. You've paid for insurance for a purpose. And the purpose is, in the event of a tragedy, in the event of something happening, you have somebody to go to. And we have that happening also if you're a pedestrian and you're hit by a car. What do? Some people don't have automobile insurance. Well, the person who hit you, they would have insurance, and that insurance company would pay for your accident benefits, for the medical rehabilitation and any other benefits that you're entitled to. So very important. But what happens? What happens if you need a lot more benefits than what your insurance company can provide? Well, if somebody else was at fault for the accident, you're also entitled to bring a claim against them. And so their insurance company kicks in, and their insurance company is going to be on the hook for anything that your insurance company does not provide. So oftentimes, just to recap here, when you're in a car accident, you need treatments for those injuries. You should get them immediately. There's going to be someone who's going to be paying for them. It's your own insurance company. And oftentimes, we as lawyers work with clinics very closely to make sure that nothing falls through the cracks. All the treatments are provided and paid for. And the individual who suffered the injuries doesn't have to worry about it. They don't have to worry about anything except for getting better.
Dr. Lee, do you find that, as Savan said, getting treated quickly, immediately, do you find people that are generally on the ball and, as soon as the accident's been cleared up, they're heading towards a clinic once they get some approval, maybe once they've talked to their insurance company? And then how do you deal with that? Oh, I feel guilty making a claim. I feel like a scumbag, using my insurance for this, right? As Savan said, people feel that they shouldn't be tapping into it, but they should.
They absolutely should. Also, when you consider, if we want to have a discussion around the politics of healthcare, and you have something like the OHIP system where we're all paying into that, is it really fair when you think about scamming, if you're that type of person where you're paying for insurance, you've been in a car accident, you're entitled to those accident benefits for your treatment? Is it really fair to be tapping into the OHIP system, which is paid by all of us, when you have something else? That's why these things exist. We have different types of insurances, health insurances, for different types of problems that happen. And you know what? Unfortunately, if you're sitting at home and you get sick, that's why we have OHIP. But you know what? If you're hurt in a car accident, you have car insurance, which is mandated, as Savan said, you have to have it. Well, then that's where your accident benefits should come from. And in doing this type of stuff, this also, when we look at it, we have to remember, if we like our HOPE system and we want it to stick around, it's all of our responsibilities to manage it properly. And managing it properly also means using the proper benefits that are available to you if you're hurt in different types of things, such as a car accident, or it's a disability claim, which means you go through your disability insurance, et cetera, et cetera. This is very important for people to understand that these things are available, and that's what's going to make the system run very well. And it's very, very important to touch on the first point that you made about getting treatment right away. It is extremely, even a lot of times, I'll be honest, people have come in very acute stage. They're not getting a lot of treatment in my office. They're getting a lot of advice on what to do in the first 3 to 5 days. But that's my job as a professional, or my team's job. The average person doesn't know what to do. So go get checked out right away. Go get assessed quickly. You may not necessarily be starting the rehab process for 5 to 7 days after, but in those first 3 to 7 days, what you do at home could matter just as much as what you don't do. And so doing the proper things, you don't have an understanding of exactly what happened, what the injury is. And you know what? Dr. Google is a very dangerous thing to just type in whiplash and figure out, okay, yeah, I'll just do this or that. No. It needs to be, healthcare needs to be tailored towards the individual problem. And everybody gets hurt a different way, and everybody heals a different way. And that's why professionals in my team, we're trained to look at the individual and make a recommendation specifically to that individual.
So take a minute here and just tell us what you think. You mentioned some things you'll tell them off the top to take care of in the first 5 to 7 days. Like what? Of course, the injury would be different,
Yeah,
but generally.
One of the things that I like to talk about with any injury is something that I talk about: active rest. So once upon a time, we used to tell people to rest, and that just meant lay in bed. And I'm not a proponent for that, because that actually in research is shown to cause more injuries. So active rest is where you minimize the things that you're doing day to day that may potentially be aggravating towards your specific complaint. Now, this is again where the assessment matters, because what you do during your day and what Sivan does during his day could be totally different. So I need to understand, what does that person do day to day? And I need to be kind of a detective and determine, okay, what are the things that they're doing that could potentially aggravate this type of injury? And then what I'll recommend is things to avoid that they're doing that could be potentially dangerous, and keep doing the things that I think would be beneficial. One of the things that I always tell people is you got to keep moving. Even if it's just walking around your house, very low level walking, it just keeps the blood flow. One of the important things in healing is blood flow to the area in order to have that blood flow help heal the area. If you're not moving around and you're in a static posture, that limits the amount of blood flow that you have, and it's going to delay the healing time. So rest, complete rest, is not a good idea, but active rest, where it's based on an assessment with looking at what's good with what you're doing and what's potentially bad, and getting the specific recommendations of, okay, keep doing this and stop doing that, is very important in the first few days.
416-870-6400, star 640 on cell. You have calls or concerns or questions for Sivan or Dr. Lou in the next 20 minutes or so. Lay them on us. We got lines are open right here on the Dr. Payne Show. Talk Radio, AM 640. It is 12:44. That is the number to call. We got some open lines. You got some time to 1 o'clock to give Dr. Lou a call here. 416-870-6400, star 640 on cell. Joe, good afternoon. How are you, pal?
Hi. Good, thanks. Good afternoon, gentlemen. I'll tell you initially what my symptoms were. I noticed I couldn't really close my hand, especially where the middle finger, index finger, and my thumb are. I was feeling excruciating pain right around the elbow and just, I guess, below there. I went to get in, my doctor referred me to an ultrasound, which I'm reading the report right now. I guess it's tennis elbow, but the medical term, lateral epicondylitis. I apologize, my pronunciation is off. Initially, I was prescribed Vimovo, an anti-inflammatory, which helped. It was put on 2 tablets a day for 7 days, and also the prescription cream. I believe it was like a Voltaren prescription. I have to get it done at a special pharmacy. But my question is, what's the long-term prognosis here? Because although the pain is not as excruciating as it is, certain very light lifting activities do tend to aggravate the area.
Right. Okay. So you're absolutely right with the medical term being lateral epicondylitis. Now, anytime some type of medical term ends in itis, it suggests an inflammatory component, which is why you were prescribed anti-inflammatories for this. The reality is that there's been a lot of research done towards tennis elbow and golfer's elbow, which is just epicondylitis. One is on the inside of the elbow and the other one's on the outside of the elbow. They're both the same type of pathology. What they've actually found when they look at this under a microscope and look at it histologically, there's no actual inflammation component. So using a term like epicondylitis is actually wrong. And what they've moved towards now is using the term epicondylosis, which osis just suggests a pain syndrome. And when you look at this under a microscope, what's actually happening is there's not an inflammatory component. What there is as your muscle turns into a tendon and turns into bone, it's not a smooth transition. Cells are changing as you look at that under a microscope. And what ends up happening is there's a fraying of the tendon actually going on a very microscopic level. So that anti-inflammatory, although it may have helped in the initial stage of the pain, if you don't do anything in the way of actual therapy to that area to affect that micro lacerations that are occurring, the prognosis is not good and can become a very chronic issue. So I would recommend that this is something that you need to have some type of therapy done on in order to really affect those micro lacerations. A lot of it, when we treat this type of stuff, is we're actually inducing a certain level of controlled trauma in order to allow that area to heal the proper way, because the body has a faulty mechanism of trying to heal in a haphazard way. It lays down fibers fibers in all different ways because it's actually stronger that way. But what happens in that instance when fibers are not laid in the direction of movement, it hinders movement, which creates long-term pain. So the simple answer for you, Joe, is that the prognosis, if you do nothing else, is probably not very good. But if you do get it treated specifically by someone who knows what they're doing, it's a very easy thing to treat properly.
Would there be any sort of stretches or, I guess, light exercises to assist that you would?
There definitely would be a component, but this is where an actual assessment specific to your issue, like I alluded to when we were talking earlier with Savan about assessing an individual and looking at an individual. I'm not a big fan of making general recommendations in terms of exercises or stretches for something like tennis elbow, because your tennis elbow and John's tennis elbow and Savan's tennis elbow can all be very different, and therefore my stretches for that specific individual would be different. So I think it's definitely something that you need to get looked at and get specific recommendations.
I wish one time you'd go into some detail when you give an answer. It'd be really good. If you'd actually expand a little bit on what you're trying to say. So we're talking about long-term disability as well, how important it is to have a good clinic and support on the legal cases side. So I'll talk to you first about the clinic component. You must get a lot of LTD cases in your clinic.
Yeah, for sure. It's absolutely essential to have a good clinic on your side that's providing the right care, first and foremost. We talked about this last week on Savan's show, well-documented files on that patient, because that's very important when you're going to a legal process, that you have files that really highlight all the important things. It's not just enough to say area of the body hurt, some testing, here's the diagnosis, here's what we do. No. It has to be much more. You have to get into the specifics surrounding the accident. You have to look at the other things that this person may have, comorbidities, medications that they're on prior to the accident, medications that they're now taking as a result of the accident, looking at their social history. How's this affecting their relationships? This is something that is often forgot when people go through these types of injuries, is how does that injury affect your life from a psychological and sociological perspective? How is it affecting you mentally? And how is it affecting your relationships with other people? Because when you're hurt, it can really be a game changer. And we've talked about this before, where I've met thousands of people in chronic pain, and it's absolutely destroyed everything in their life. And I'm sure Savan would agree that these things are very important, that the clinic assesses and makes the proper documentation around it. The other thing that's very important in this, which is often not done with these types of injuries, is a lot of the therapy that's directed to the person is passive. What I mean by passive is that it's the clinician, whoever they're seeing, doing an intervention to them, and then they go home. And what's often forgotten is the active component of care. That individual needs to be doing a lot of the right things when they leave that office.
The other 23 hours,
yeah,
right?
And that's exactly what I say. Come to my office every day, 1 hour a day. You still have 23 hours every day. You got to be doing the right things. You need the right professional to tell you what those things are.
We'll get Savan to talk about the other side of that particular component. 416-870-6400 star 640 on cell. It's a Dr. Payne Show. It's Talk Radio, AM 640.
The Dr. Payne Show is a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Talk Radio AM 640. If you'd like to know more about what you hear on today's show, please visit paincarecanada.com or call me directly at 1-855-55-DR-LOU. That's DRLOU.
Last few minutes here of the show. Yeah, still got time for a phone call or two if you want to slide through. 416-870-6400 star 640 on cell. So yeah, we were talking about long-term disability and how you deal with it on your side.
Yeah.
And Savan, I know it's a big hurdle for you guys as well, right?
It is. It's a very big hurdle. And oftentimes when people come to me, it's because they've been cut off long-term disability or denied the claim. And one of the first things that I ask them is, what is the nature of your disability? The second question is, what kind of treatments have you been getting? And do you continue getting them? Because when an insurance company assesses a claim, and when I have to fight the insurance company, which is not that difficult if I have the documentation I need, I have to show them that this person has X and Y disability. I don't know if it's arthritis or an injury, whatever it is, that they've been going to treatments, and that we have the proper reports from the clinicians, from the treatment providers. And that's also very, very crucial, that when you go and get treatments, that you have somebody who's willing to support you through the disability process. Me as a lawyer, there's only so much that I can do. I know the strategy. I've worked for insurance companies in the past. I know where to hit them. I know how to maximize the value of the claim for my clients. But there is a counterpart here, and the counterpart is the clinic. It's the practitioners. It's the chiropractor, the massage therapist, whoever it is that is doing the actual work day to day. So it's a team approach, and that's really, really crucial. And without that, my ability to represent my clients is diminished.
Mm-hmm. So moving forward, I mean, we got a couple minutes left here of the show. So as we mentioned off the top, we're getting into that season where there's going to be a lot of slip and falls for both you guys, a lot of car accidents for both you guys. What are your suggestions just as far as a clinician moving forward to people that's, try to minimize damage that's going to happen or could happen this winter as far as taking care of themselves is concerned?
We started the show by saying the free pain consultation. Right. Give us a call, 1-855-55-Dr. Lou. We can set up a 10 to 15-minute conversation via phone if it's not convenient for you to come into the clinic. You can also come into the clinic, whatever is more convenient for the people listening, and get my opinion on it. It's not going to cost you anything. It's just a conversation that we're going to have. If it's something that I think I can help you with, I'm going to let you know. If it's something that I don't think I can help you with, I'll make sure that I try finding someone who can. Also, if you're calling me and you've been involved like something like this and you don't have a lawyer, I'm going to get you in touch with Savan. I want people to know that there's a team approach that I have at my clinics in order to get people better. And that team includes whatever it's going to take to get that person better. That's the all-encompassing approach to multidisciplinary care. And that's what we have to move towards as a society is forget this one person approach, because no one professional, healthcare professional, can deal with everything. You have to have a good team around you. And my success with patients is not a direct result of just me on my own. It's a direct result of the people I've surrounded myself with. And
I know, Savan, you've often said, the most maximize your protection when it comes to your insurance. You've always said that because it benefits for when you go see Dr. Lou as well, right?
Exactly. And again, just to reiterate what Dr. Lou is saying, it's a team approach. And one of the things that I really like about his show and the way that he approaches treatments is that he's there to provide information, not just the actual treatments that his clinics provide, but provide information. And, oftentimes you go to clinics, you go to lawyers, everyone wants you nickel and dime you. Everyone wants to get something from you. We're here to provide this information. It's going to cost you nothing to have a quick chat with us. We can tell you very quickly what we can do for you. And oftentimes that's what people need. It's to make an informed decision. And by having this team approach, you're maximizing not only your treatments, but the compensation you could potentially get as a result of your injuries.
We've often said, no posture is the best posture. Keep moving, right?
Yeah,
keep
for
moving.
Sure.
Keep yourself healthy.
Yeah, and I'm always big on commenting on research and what gets people better. And like Savan just said, and I said, and I want to highlight it again, education and advice empowerment are the things that always show up in research as the best outcomes for people. And Savan's right. There's a lot of people just worried about nickeling and diming you and not actually giving you good advice. That's why we do the shows that we do. It's to provide good advice and have a conversation with people and give them the right advice. And that's not going to cost anybody anything, to just have a conversation. And that conversation could be the difference between you being healthy for the rest of your life or suffering from chronic pain. I've said this to you before. Chronic pain is stage 4 of pain. That's what happens. It's you do the wrong thing in the beginning, everything's going to spiral out of control. Then you're in that chronic pain syndrome. And, if you haven't been through it or you don't know anybody that's gone through it, it's a horrible thing to be in chronic pain, to live with it. It affects every aspect of your life. And again, if you're listening to this show and you know that people that are suffering from this type of thing, that have been involved in these things, it's not just about you calling us. It's get your family in touch with us. Get your friends in touch with us. We can help you.
Until next weekend, 1-855-Dr. Lou and info@paincarecanada.com. It's been the Dr. Pain Show. Thanks again to Savan from the Insurance Injury Law Show here on 640 as well. Till next time, the Dr. Pain Show, Talk Radio, AM 640.
You've been listening to the Dr. Pain Show, a paid commercial program. Unless otherwise identified, the guests on the program are employees of the advertiser. Opinions expressed are those of the advertiser and do not necessarily reflect the views and policies of Talk Radio AM 640. If you would like to know more about what you hear on today's show, please visit paincarecanada.com or